Hello and a very warm welcome to this topic-based education session for patients and professionals. This evening's topic is smell and taste changes following a virus, including Covid-19. I'm Mags Robinson, Support and Information Officer for Fifth Sense, the charity for people affected by smell and taste disorders. With me today are my colleagues Sally Connick, Community Development Officer, and Sarah Pearce, our Director of Services and Operations. Sally and Sarah will be in the background, making sure everything runs smoothly tonight. It's my pleasure to welcome our guest speakers, Mr. Okechukwu Okonkwo and Hannah Martin. Mr. Okonkwo, Oki, is an ENT surgeon with a special interest in smell and taste disorders. Hannah is one of our two expert patients this evening. Our other expert patient, Jenny Thomas, has kindly recorded her contributions, so you'll meet her later. Thank you both for joining us. So just a little housekeeping before we dive into our topic for the evening. Firstly, a word about taste. So most people who are experiencing a smell disorder may also find their sense of taste is affected. It's not taste itself, it's a perception of flavour that is affected. True taste-specific disorders are rare. They're far less common than smell disorders. And we are planning to run one of these sessions that's all about taste on the 25th of November. So if that's something that you're affected by, that's the one to join as well. Okay, so this event is being recorded. So please make sure you're muted throughout. And if you have any technical difficulties, please private message Sally or Sarah in the chat, and they'll be dropping links into the chat as we go. They'll be happy to help. Okay, the session will be split into three parts. So first we'll hear from our expert patients. So Hannah will share her personal story since she first lost her sense of smell in 2011. And then we'll play Jenny's video in which she talks about her experience of living with very distressing smell distortions. Both will talk about the impact, and then they'll talk about coping strategies. And then we'll hand over to Oki, who will explain about post-viral smell and taste changes. He'll talk about diagnosis, patient management, and current treatment options. He'll also be suggesting some self-help ideas for patients with smell and taste disorders following a virus. And he'll talk about some potential future treatments. So please feel free to drop comments into the chat box during the presentations. And you can also drop questions for Oki into the chat as we go along. I'll ask the questions of Oki on your behalf after his presentation. And please be aware he can't give individual medical advice. It would be really helpful if you would prefix your questions with a Q, just so we can spot them easily and you know, they don't get lost in the chat. Okay. So following Oki's presentation, there'll be a Q&A session, and after that, there'll be time for you to complete just a very simple survey, so you can give us some feedback, so that'll help us to better understand what we did well, what we can do better, and it'll inform how we run these future events. So I'd like to hand over now to Hannah. Thanks for talking today, Hannah. Could I ask by asking you to tell us about your history of smell loss and what you've gone through over the last 13 years, including the impact that smell loss has had on you and any medical support you've had? Thank you.
Yeah, of course. No problems. And thank you for having me tonight. So in Christmas 2011, I had sinusitis, laryngitis and a cold all at the same time. I worked in a hospital pharmacy and we handled anaesthetic gases. Initially, I didn't think anything of it and I didn't want to be a bother. So, however, in February 2014, we had a broken vial of bone cement and the rest of my colleagues made a comment of, my God, that reeks. And I couldn't smell a thing. So I then asked my GP for a direct referral via the Choose and Book system to see an ENT specialist at my workplace. Now, between May 2014 and May 2015, I saw an ENT specialist and I went through rounds of drug therapies. I had 2 lots of investigations with a camera up my nose, a CT scan, which just told me that I didn't have a tumour or, in the ENT specialist words, anything nasty. And I had the joys of lots of nasal rinsing. Eventually, we resorted to surgery in March 2014, which took 2 weeks to recover from. And on the 6th of May 2015, I was told that they'd exhausted all of the options and that there was nothing else they could do for me. I was stuck with anosmia for life. I didn't have any further follow-ups with ENT or my GPs. So the impact, I was 20 at the I had no idea of anyone else who actually had the condition either. I felt abandoned, and from the moment that they'd said there was nothing they could do, it felt like there was a door shut in my face. It seemed like all the colour just drained from my world, and that it was a type of grief and that I was just going through the motions. There was no support offered, and it just enhanced the depression I felt, and sometimes I felt humiliation because people just didn't understand what it was. I felt despondent and often at the end of my rope. I'm not going to lie, I did actually wonder if it was all worth it.
Gosh, thank you, Hannah. Thank you for sharing that. From initially not thinking anything about it to that gradual realization of the impact that was having on your life, including safety, to the point where you just were discharged feeling abandoned. I think that will resonate with a lot of our attendees today. It's a very powerful testimony and it will resonate with a lot of people. So that's the kind of thing we're hoping to influence with Fifth Sense and the work that we're doing. So now Sally's going to play Jenny's recording in which she talks about her history of smell distortion over the past 4 years from onset until now.
Hi, I'm Jenny. When we went into lockdown in March 2020, I developed really bad hay fever, and during that August, my sense of smell and taste began to diminish. And by September, I've lost my sense of smell and taste altogether. I didn't contact the GP at that stage. We were in the middle of a global pandemic, and I just didn't think I should have them. In January 2021, my smell and taste had begun to return. I thought there was a problem with the drains in my house. There was a constant smell of sewage. And certain food began to taste off, onion and garlic in particular. In March 2021, taste was getting more distorted. I managed to get a telephone appointment with a GP who told me I must have had COVID and there was nothing I could do. July 2021 was really terrible. Without warning, my smell and taste just completely. Smells would make me feel really nauseous, and most foods became intolerable to me, making me gag if I tried to eat them. I couldn't eat fish, meat, eggs, most fruit, vegetables or salad items. My diet basically consisted of bread and cheese. I was able to have a little bit of milk in my tea, which I was still able to drink. But I couldn't smell if it had gone off and made myself ill a few times. Even tap water sometimes I tasted like sewage and I couldn't drink it. The impacts on my life were completely overwhelming. Every aspect of my life was affected. Being outside was terrible. In the park, smelt of the drains, vehicle fumes, smell of burnt plastic. Shops, cafes and restaurants had various obnoxious smells. And the foul smell of barbecues meant that I stayed indoors with the windows closed most of the time. Even when I was out filling the car with petrol every day, and even a mask on a nose clip on public transport tolerable. Inside wasn't much better, to be honest. I used normal washing up liquid, cleaning products, shower gels, etc. Mint was a particular trigger, so I even couldn't use toothpaste. My own body odour smelled of rotten onions, so I'd have numerous showers every day, and even my own urine smelled foul. Relationships became off limits because of other people's smells, and friendships suffered because nobody could understand what I was going through. My mental health plummeted. During this period, I did discover Fifth Sense and it became a lifeline to me. I attended some online talks and then a Let's Talk Smell and Taste event. I was persuaded I should go back to my GP. So I did that, who agreed to do a blood test, but refused any referrals to ENT, a dietitian, or mental. As the GP was insistent that I must have had COVID, I did have some antibody privately, but they all came back negative. And I eventually, after many appointments, persuaded the GP to refer me to ENT. In November 2021, I had saved some money and saw an ENT consultant find. He wanted to do a CT scan and some more blood tests, but I couldn't afford those. And so I had to wait until April 2022 when I eventually got to ENT on the NHS. Every ENT appointment I've had since then has been with a different doctor, and they've all had different opinions about the cause or what's wrong with me. That it was COVID, it's allergies, I've had a deviated septum, I have chronic rhinosinusitis. I was told to do smell training, and I found that absolutely abhorrent because the smells just made me sick. The 5th Sense conference in November 2023 was fantastic. It armed me with more information, and on the back of that, I contacted PALS with a list of requests to happen. I was given an appointment with a consultant January 24. The consultant told me there was nothing further they could do. A CT scan and MRI showed nothing. I was just told to continue using nasal rinses and sprays that I'd previously used myself, and was discharged. Having spoken to 5th Sense, I am going to go back to my GP and ask for a referral to a specialist smell and taste clinic in Liverpool. I also found out that in my area I could refer myself to mental health support, and I did that. It was the one thing that really helped me through this. The therapist I got specialised in people with chronic pain that worked with me, not just to improve my mental health, but to help me go out and to live my life again. And over this, I've just found how much we rely on food. It's a huge part of everyday life. We have to eat. And when you're no longer able to eat things, it affects both your physical and mental health. I've lost 2 senses, smell and taste. Well, started. And I often wonder what would happen if I'd gone blind or deaf. I'm sure if I went to the doctor with those symptoms, I'd have been treated really differently. Thank you.
Thanks, Sally, for that. So yes, I'd like to thank Jenny for another powerful testimony. Both of our expert patients have painted really vivid pictures for us about the reality of living with ongoing changes to their senses of smell and taste, and the need for ongoing care by the medical profession. So back to you, Hannah. Could you tell us a bit more about the coping strategies that you've used to try and manage living with your smell loss in daily life?
Yeah, so the years that followed my diagnosis in May 2015, I often refer to as the learning years, as I needed to figure everything out on my own. So with regards to food, I'm very fortunate that I've never had food poisoning as a result of my condition. However, I have had to learn some things the hard way. So I managed to over-season chicken that my mum and I were eating. Oops. I now avoid spicy food following eating too many pieces of a dessert in a restaurant, which include pineapples soaked in Malibu with chili powder sprinkled. So safety-wise, I know Mags touched on this. I nearly blew the house up when our gas-fed eye-level grill went out while my back was turned. It stopped me from cooking independently for nearly a decade. So I have a designated nose. Every time I go shopping for perfume or body spray, I have to use the same thing all the time because I know what that's like. Not that I can smell it, but my mum, who is my designated nose, tells me that it works okay with my skin. So, but she has to be with me if I can't get that particular brand for any reason. I found 5th Sense in December 2022, and like Jenny, it's become a lifeline for me. I found my people and my community. So my quality of life has greatly improved, and they've helped me realise that I'm not my condition. So really do attend those calls, because you just realise that you're not alone.
Thank you, Hannah. It's wonderful to hear that you've got such a strong support network around you, your parents, your family. You're all brilliant, and they're all brilliant at supporting you, because you've explained to them the impact on you and they know. And that's one of the challenges for a lot of people. It's very hard to explain the impact that this is having on you. So one tip for people might be to share this video with people. The recording will be available after the session in the next couple of days. So sharing this with people around you might be a good idea, so that they understand the impact and it's not just you. And like Jenny, you know, reaching out for support with your mental health has been key, hasn't it? Your mental and emotional well-being. It's really important. And both of our volunteers are doing work with Fifth Sense, which is giving you that sense of making something positive out of quite a negative situation. And we're certainly very grateful for the support that you both gave. So Sally's going to play Jenny's short clip about how she copes with parosmia.
So how do I cope with this in daily life? It's been difficult, but things are improving slowly, and I have been able to expand my diet. And I'm learning, you know, and finding ways to cope. I have to. In terms of food, I know what I can eat and what I can't. I'm open to tasting things to see if things are improving. At home, I cook my meals from scratch, so I know what's in them. And if I go to restaurants, I'll try and provide them a list of the foods I can eat and can't tolerate in advance. If I arrive at a restaurant without a booking, I'll tell them I have an intolerance, and then they will tend to prepare some for me. In the house, I use fragrance-free products, whether that is washing up liquid, detergent, shower gel, deodorant. I found a toothpaste that was developed for children with autism. It has no flavour, and I use that. I love to travel, and it took me a long time to get my head around doing that again. But I just do different trips now. I go self-catering with friends. And then, you know, finding restaurants where I can eat. So it's just a new challenge, but can make the holiday more interesting. And overall, people can be really accommodating and try to do their best for you. Every small improvement is a positive step. I remain hopeful. I really do, that one day things will fully get better. And I do try to remain positive all the time. And it was through the therapy that, you know, I found a way to navigate my new normal and get on with things. I wouldn't be where I am today, though, without the help. They've really supported me through this journey and do incredible work. I'd encourage anybody with parosmia to come along and get involved and have to offer. And also for professionals too, they can learn so much about this very little understood condition that has massive impact on everyday life. Thank you.
Thank you, Sally, for sharing that. Sorry, I lost my place for a moment there on what I was going to say. So what I'd like to do now then, Hannah, is just ask you to sum up for us briefly. But just before that, my train of thought was I was wanting to say that Jenny actually co-hosts our parosmia support group. So we have support groups, Let's Talk Smell and Taste events for people to join, talk to other people. They're really popular for people to join, and that's a really good way to talk to other people who really get it and really understand what you're going through. That's what I was wanting to say. So, and more about what Jenny's doing to volunteer towards the end of the session. So Hannah, if you wouldn't mind just summing up, what advice would you give to patients and to professionals?
Yeah, so to patients, just keep looking. It may feel hopeless, especially when the professionals turn around and say, there's nothing else we can do. There will be something in the future. So don't be afraid to go looking for it. I would advise you of that. And for professionals, with regards to like helping patients on their journey, you're vital in not just diagnosing and treating patients, but in helping them take those first frightening and life-altering steps in managing these conditions. You are the person that they will see and will remember for time going forward.
Thanks, Hannah. That's great. Okay, so now I'd like to hand over to our expert speaker, Oki. Please don't forget, if you've got questions for Oki, please mark them with a Q so we can spot them easily in the chat and ask them of Oki on your behalf after his talk. Thanks, Oki.
Good evening, everyone. My name is Okonkwo. I'm a consultant rhinologist at Gloucestershire Royal Hospital. I'm based in the southwest of England, and I run a specialist smell and taste clinic. So I'm just going to take you through my view on my experience of managing patients with smell and taste disorders post-viruses. Okay. So in Gloucestershire, we are a trust that serves 800,000 people, and we run a range of innovative medical rhinology services, and our smell and taste services is one of those. Now, smell is the sense of memory and desire. We've had some very powerful testimonies from our patients, and they've really and it really highlights how important it is this is taken seriously on a clinical point of view, and how as someone who's suffering from a chemosensory disorder or smell and taste disorder, that you do seek help, because there are things that can be done to help and support you. We're not always able to provide a cure. This speciality is still very much in its infancy, and we're finding out lots and lots about it. There's certainly groups like Fifth Sense that do an amazing amount of work to help support you through your journey. So smell and taste disorders were brought into the limelight by COVID-19. Certainly the earliest strains of the COVID pandemic, it was one of the standout features, or diagnostic features. And we know that smell disorders happen in up to 80% of people who'd experienced COVID, and taste disorder, associated taste disorder, happening in 40%. And we, over the last 4 years, we've come up with a rough timeline of the recovery patients make from a smell and taste loss after a virus. So approximately half of people make a full recovery. 45% of people make a partial recovery, whether that means you are left hyposmic, which is with a reduced sense of smell, or whether you are left with some parosmia, so that's a distorted sense of smell. And however, there is a proportion of people that are left anosmic. However, smell and taste disorders as a result of viruses were around long before COVID, and there are case reports in the literature where patients have had a recovery, a spontaneous recovery of their smell and taste up to 8 years after the initial insult. What's special about those patients? What happened? We don't know. But those are the things that we're looking into. So this is our service. So Fifth Sense did a great piece of work with patients to find out the challenges that they were facing accessing medical services. And this was a good piece of evidence that helped boost our application for our smell and taste service. It resonates very loudly with people traveling up to 200 miles to see a specialist and interested in smell and taste disorder. So how prevalent are smell and taste disorders? So they affect up to 25% of the population. There's really a hidden problem, and up to 40% of people over 65. As we've heard from some of our testimonies, they are associated with mood disorders in up to 15% of patients. So really, mental health support is vital if this is something you're struggling with. And it's because it has an impact on your quality of life. Food, safety, relationships, and experiences. If I take you back to that first quote, smell is a sense of memory and desire. A lot of our memories of holidays, places we've been, things we've done are linked to smell. It's a key sense. So we're focusing on olfaction. So smell disorders can be split into quantitative or qualitative. So quantitative is the sensitivity of your sense of smell. And so that is the hypotonic group. People have reduced sense of smell and have no sense of smell. And then qualitative, which is the quality of your smell. So this fits more to people who suffer from parosmia. So there's been a lot of work over the last 2 years into classifying smell and taste disorders. And I put in these slides just to show that this is a complex condition. Okay. Whenever you go and see a specialist, they have to consider a whole range of differential diagnoses. Some common, some more uncommon, and some very, very rare. So these are all things that have to be thought about. And we're going to focus on our post-infectious olfactory disorders. Okay, so smell loss after a virus. So as I've mentioned before, it's an uncertain prognosis. So COVID brought us into the limelight, and from recent studies that have come out, so we've actually found out that over half of people whose sense of smell and taste is affected by a virus actually end up developing parosmia, which lasts a variable duration. So there is some spontaneous resolution at about 3 to 4 months on average, but it can be on to 7 months. As I said, the duration, we're still finding out more. Why does it happen? Why is your sense of smell affected by a virus? We don't know, but there are a number of theories. So studies have shown that there are some structural changes in that sensitive olfactory lining. So the lining of the nose where the nerves of smell live. And these changes can lead to a reduction in the number of nerves that you have, smell nerves that you have. And as a result, it results in your olfactory bulb, so that part in the brain that's partly responsible for processing smells, actually being smaller in people who have experienced a smell loss after a viral infection. And one of the things that we know is that time is nerve. So the treatments that we're doing are now focusing on trying to regenerate some of that nerve tissue that's been affected. Okay. So neuroregenerative treatments are what most studies are focusing on at the moment. So because of the complexity of smell and taste disorders, I like this quote because it's something that as clinicians we have to be aware of. Okay, we like to do the same thing over and over again, but we have to be cognizant that just because we've got a hammer, everything we're treating is not a nail. So that means everybody has to be treated as an individual, and we have to look at the potential different causes for why you have lost your sense of smell. So we have to investigate and treat any reversible factors, identifying those are things that we can change, identify things that we can't change, because that's really important in giving you as a patient an idea of that prognosis. There are lifestyle things that patients can change in order to help themselves. So we know that smokers have increased olfactory functions increased in smokers by a rate of 59%. And your sense of smell can take up to 6 years to improve after you stop smoking. So this, amongst other things, things patients can look at, and counselling, as we've discussed earlier, and as we've heard, this is a hard journey. This is a long road, and offering support from mental health point of view is important. So, what is the key tool in our armamentarium? So I like this image because it's smell training. We need to retrain your nose. Okay, this is the best treatment that we have, but it only works in 30% of patients. Okay, so we don't know who it will work in, but it's something that we advise all patients to try. So how does it work? So it helps regenerate some of those lost neural pathways within the brain. And the classic paper says to do 4 smells over 3 months. Okay. But recent papers have shown that the longer you do it, the better. And it's really important to try and engage in a practice of mindful smelling. So classically, you're told to smell 4 essential oils. So lemon, eucalyptus, rose, and cloves. But I advise my patients to do active smelling. So whenever you're in the kitchen cooking something, if you, for example, if you've got an orange, look at the orange, smell it, feel it, so that you have all these other sensory inputs to try and help you recognize that this smell, however it may smell to you, is an orange. Because what it smells is essentially a sense of chemical signals. Okay, and it's getting your brain to associate this particular chemical signal with what you're smelling. So now we're going on to the to therapy options that have less evidence, but are still show some promise. So use of high dose omega-3 tablets. So omega-3 again is something that has a neuroprotective effect and has been shown to be useful in patients who are undergoing surgery that's associated with smell loss. Patients who lost sense of smell due to a virus. Vitamin A. So there's a study currently being undergone in Norwich by Professor Carl Philpott looking at the impact of vitamin A on your sense of smell. And it's topical vitamin A drops. And it has been shown to improve your threshold indiscrimination score. So these are things that we test for in patients who've lost their sense of smell. So when you use your vitamin A or when you use any nasal drops, there's a special technique, something called the Kaitiki position, where we ask you to lie down with your head at an angle and 20 degrees, and you instill the drops on each side. You keep your head in the same position for a minute before you switch over to the other side. And there's also a nice video of this on the website. So there are other supplements, over-the-counter supplements that are available, something called PA Lute. There's some studies looking at this, and this is an amino acid that some studies have shown can be helpful when combined with olfactory training. And now the newest kid on the block that's getting a lot of interest in medical research into olfactory disorders is use of platelet-rich plasma. So this is used in other aspects of medicine to regenerate growth factors, and it's used in knees, it's used in skin. But there are some promising studies to show it can help regenerate those delicate olfactory nerves with a series of injections into the olfactory cleft, so into the nose. These are all still in their infancy, but it's something that is another potentially promising intervention to try and help patients, especially when combined with use of olfactory training. Now, is there a role for surgery? So there are some procedures that I will do and some procedures that I have been asked to do. So, for example, sinus surgery can be useful in the right patients who have nasal polyps. And as for all the rest of these procedures, certainly the first 2, septoplasty and rhinoplasty, you have to have careful patient selection to see if it works for them. Okay. The last two, there is no evidence whatsoever to support their use in managing someone who has a smell and taste disorder. And we've got some conflicting evidence. There are some other treatments there in the literature that you may be offered by your healthcare professional. So these are things like gabapentin, intranasal theophylline, some of which I use, some of which I don't use. It all depends as to where you are in the pathway and whether I, as a clinician, think that it will be a useful thing to try for you, because they do have a significant side effect profile. So just in summary, when looking after patients who have a smell and taste disorder, it's important to look for reversible and non-reversible factors. This helps give patients an idea of the prognosis. Look at lifestyle modification, especially things like stopping smoking and use of supplements. Counselling, really important to help support patients through that journey. And directing to support systems like the Fifth Sense Group. Olfactory training is the mainstay of treatment. And then other things like steroid nasal rinses, vitamin A nasal drops, omega-3, platelets-rich plasma, all have some promising effects, but not in everybody. So this is another nice quote that I like. So smell is a potent wizard that transports you across thousands of miles in all the years you've lived. So this just shows how important a sense it is and how seriously it should be taken by healthcare professionals. Thank you. Any questions? Lovely.
Apologies, I couldn't find my button to unmute.
No
I've
problem.
been trying to get the questions ready for you. Okay, so thank you. That was really great. A really good overview of everything. We've had quite a lot of questions. I've tried to put them into different categories. Apologies if I miss anything or we run out of time. There's a few more coming in now, but I'll start with the ones that I've worked out so far. So just very briefly, can you answer what was the earliest case of smell and taste loss due to COVID, earliest documented case?
I'm not sure what the earliest documented case was of smell and taste loss due to COVID, but certainly in the early few months of lockdown and COVID pandemic, we were noticing a pattern, and ENT UK worked very closely with the government to highlight, actually, well, do you know what, there is a problem. I mean, I saw my first COVID patient pre-lockdown, so that was so I saw them in February 2020. But we know in Italy, this pandemic had been going on long before that, devastating their ITUs. So patients who travelled might have had it and have brought it home, but because we weren't looking for it or weren't aware for it, could have been as early as 2019. So linked to COVID, possibly even earlier.
Thank you. Okay, so someone's asking, are there documented cases like myself of people getting COVID, getting anosmia, gaining their smell and taste back, and then 9 months later getting flu, not COVID, and then getting anosmia again, and then parosmia?
So we know that if you have a virus that leads to you losing your sense of smell, that leads to a change in your olfactory mucosa. So you have less olfactory mucosa, you have some scar tissue. We know that the size of the olfactory bulb can shrink. So you have less reserve. So therefore, if you have another significant infection, so you've gone from 100% to 75%, you have another infection that can take you down a notch. And we do know that people lose their sense of smell due to a virus, as I showed in my slide, which was specifically to do with COVID, but other viruses are responsible for loss of sense of smell. We know that you can up to 50% of people do experience parosmia, and that can, or a significant proportion experience parosmia, and that can last for 3 to 4 months, and for some people longer than 7 months. So yes, so it's not unheard of.
Okay, Thank you. So, is there a known proportion of smokers who have become anosmic?
So we know that smoking reduces the sensitivity of your sense of taste and smell, because it changes the lining of your nose. It causes respiratory metaplasia, which is why it causes all the lung troubles, and your nose is lined by respiratory epithelium. So smoking reduces your reserve of olfactory tissue. So therefore, if you do undergo any insults, whether that's a head injury, aging, so we know if you're over 65, up to 40% of over 65s have some form of smell disorder or hyposmia, and that's just because nerves, as we get older, work less. And if we are, and so if we're smoking and we've had things that affect our sense of smell, and then we're having all the other things that go on with our lives, just as simple as getting older, then that can lead to loss of sense of smell.
Okay, thank you. Could smell and taste come back without treatment?
Oh, absolutely. We know that there is a huge amount of spontaneous recovery. 50% of people we never see in our clinic who experience smell and taste disorders. In fact, more than that, we don't see in our clinic. So yeah, so there is spontaneous recovery, absolutely. At what time that will occur, and for each person, I don't know. Each person has to take it on a case-by-case basis.
Okay, thank you. I lost my sense of smell post-COVID, January 2021, loss and distortion. I seem to have got bounced back these last few years after I started taking antihistamines. It's slid back slightly now, but is that something that can help long term?
So we know that there are a reasonable proportion of people with undiagnosed chronic rhinosinusitis. If you cast your mind back to that slide of the long list of causes of smell disorders, we often see patients with multiple causes. It's not just purely you've had your viral infection. Some people might have nasal polyps. Some people might have severe hay fever. Some people might have had a head injury. So yeah, so if an antihistamine has worked, maybe consider using getting checked for allergies, and that could lead to optimization of treatment of chronic rhinosinusitis if you have it.
Okay, thank you. So you mentioned Carl's study at the University of East Anglia about vitamin A nasal drops. So just a couple of questions on that. What's the way to test it? How do you buy it? How often should you spray it, and how? And would a GP be able to prescribe vitamin A nasal drops, or can it be purchased over the counter?
So this is an over-the-counter remedy. A lot of these treatments are over-the-counter supplements that you buy. So it's vitamin A liquid that you drop into the nose twice a day, and do it for 6 weeks. And you do it in that kaitiki position. If you have any burning and stinging when you put the drops in, then don't do it, because it's not for you. We don't want it to cause any problems for you. But if you're able to manage it comfortably, then it's something worth trying. And Carl is doing it looking at patients who have COVID-related smell loss.
Thank you. So in the US, there are 2 docs currently doing platelet-rich plasma therapy, one on the East Coast and one on the West Coast. Is any platelet PRP therapy being done in the UK?
So people will offer it. So there are some people that will offer it, okay, and it's something that I offer, but it's not available on the NHS. That's really, really important to be aware.
Mm-hmm.
It's not available on the NHS. At the moment, that may change, but it's still very much in its infancy.
Thank you. And a similar question, what's your opinion on stellate ganglion blocks? to recover
ganglion blocks,
smell and
there's no
taste.
evidence whatsoever that it works. I mean, even thinking of the anatomy, I mean, I actually looked at that study because someone had mentioned it to me when I was giving a talk. If you think about the anatomy, stellate ganglion's in the neck, it's nowhere near the nose. So it does not work. And it's not recommended.
Thank you. Okay, and hyperbaric oxygen therapy treatment, it's known to benefit nerve-related conditions like MS. What's your view on it for smell loss and long COVID?
It seems a relatively benign intervention. It's something, if it's something that you have access to and you can try, then by all means, please do. I'm not aware of any studies looking at hyperbaric oxygen, but I know it's used for chemotherapy. It's used in MS. So yeah, by all means, please try, and that could be an interesting avenue in the future for us to pursue.
Thank you. Is there any point in trying new therapies that you've talked about? I lost my sense of smell over 30 years ago, or 30 years ago rather.
That's a really tough question. I don't think there's any harm in trying. However, if it doesn't work, it's that balance, that impact on your mental health. There are all these new things that are coming out, and I don't know if they would work for you, but it's something that could work. You just don't know until you've tried it. So, but just pick something that has a low side effect profile. So something that's not going to cause any harm. Okay, that's what I would advise.
We'll come back to some self-help questions like smell training in a bit, just a couple more about condition really. So if there is a daily blockage of the nose, could this be affecting smell and taste? So removing this and clearing the passages, could that resolve the lack of smell and taste?
Yeah, if you have persistent blockage, yes, that clearing that could help.
Thank you. And another one about diagnosis really. My consultant believes my smell and taste loss is due to COVID, but my symptoms started in June 2019.
It's very difficult to answer, because certainly in the early days we don't know what was going on with COVID. So without knowing your story, I couldn't really comment on.
Yeah, we said you couldn't answer personal. Yeah, okay, fine. That's it on those questions. So just some on self-help really. So is there any point in smell training with items you can smell okay, or is it just to concentrate on the ones that smell to you as vile, and I would add as or you can't smell?
So I would, for me, do smells that you can smell, okay, because you want to have some positive feedback, and things that you want to try and smell. It's very difficult when patients suffer from parosmia, because I don't want anyone to put themselves through any unpleasantness, and you just have to do what you can manage that will enable you to stick to a regime, because we know continuous smelling helps improve olfactory function. Because if you think of your sense of smell as a muscle, the more you do it, the stronger it gets.
Mm-hmm, mm-hmm. And Thomas Hummel does talk, doesn't he, about consciously and intentionally testing and training our sense of smell. Just as a general thing, it's good for everyone to do, really. Okay. Using essential oils, should I change to a totally new range of essential oils after 3 months?
Variety will help, because you want to accommodate your nose to different smells. But mindful smelling is the way to go. So using everyday items around you. The reason essential oils were used, because you can study essential oils. If you're doing a research project, you're exposing patients to a certain concentration of a certain smell that's of a certain quality. the whole time. So I would, so you can change your essential oils, but use your everyday items around as well to help you.
Thank you. And we have got some videos. I think Sally's been dropping them into the chat. There's a really good video by Sarah McCartney about using everyday items in your home as part of this training. Okay, so couple of questions really. Are patients expected to do smell training under their own steam, or do GPs help? And does the NHS offer help with smell training, or should patients just get on with it themselves?
I would suggest that so GPs won't support you with it. It's something that you need to do at home. There's a big element of self-help to this. We have all the facilities in our own home. All we need to do is get into the habit. And Fifth Sense, fantastic charity. The work they're doing is amazing, and they do have all the online resources for you to do, and also a community, so you can share your experiences with other people. Because I don't know, it's like going to the gym. Having a community or people around you helps hold you accountable to your training, as it were, and helps give you different tips and tricks. You know, you're not on your own. You're not the only one going through the stroke challenges with treatment, and that can be reassuring knowing that.
That's great. And one last question, if I can find it, because I scrolled away from it. If I can smell something, why can't I taste it?
So, I mean, that's a interesting question, and it's one of those things that without seeing you and assessing you, I couldn't answer that question for you, really.
And that goes back to what we said at the beginning, really, doesn't it, Oki, that we've got a separate session about taste. And for everyone here, just because I'm conscious of time, just to be aware that if you've got any specific questions, you can email me at information@fifthsense.org.uk, and we'll give you tailored responses and try and help you if you've got specific questions. Okay, great. So the last question is there any use in taking alpha lipoic acid or zinc lozenges?
So zinc there's been some evidence to support its use in taste loss. And alpha lipoic acid, again, there's some evidence to support it in as with PA-LUT. They're sort of on the same level. So there's been some evidence to say that it can help with your loss of sense of smell. Again, it's a relatively benign supplement to take, and it's worth trying. So that's what I would suggest. It's worth trying.
Thank you so much, Oki. Thank you for your presentation and for the Q&A. That's really helpful. If there are further questions, as I say, people can just email me. I can refer some questions to consultants if there's information that we need. So do email in and we'll try to give you a tailored response. I'd just like to draw attention to a little conversation in the chat. Mohammed just asked, in a perfect world for Hannah, really, in a perfect supportive world, what would you like to see in terms of further support, diagnosis, attitude or behaviour from medical professionals, really, and a critical moment when professionals said there was nothing else that can be done? And Hannah's just answered that in an ideal world, all specialists would have contact information or be able to direct you to a charity who can help or support. This was the hardest thing when I was diagnosed for 6 years before COVID brought smell and taste into the limelight. I just got the sense that nobody believed me when I said it. I was lucky that I could bypass the GP and go straight to an ENT specialist, but there was no signposting at the time. And the biggest thing for me is to know that you're not alone. And like Oki said, there's a community here with Fifth Sense, and we really are trying to make a difference for people with smell and taste disorders. So that's the end of the session, really. But what we'd like to do is we've got some notices to share, some important things to let you know. And also we would like to give you the opportunity to give us your feedback. So Sally, I think, is going to drop the link in the chat if she hasn't already, where there's a form that you can fill in. Yes, SurveyMonkey. Yeah, thank you, Sally. And we, you know, these sessions, we would like to be able to offer more and more support to people in various ways. We're very limited. We have smell and taste, let's talk smell and taste activities. We're now running these events for patients and professionals, but we want to do more. So if you found value from this, we've made it a free event. But if you would like to make a donation, that would be very gratefully received if you can afford to do that and you've gained value from the event. So the link's in the chat there. Just some notices then. So for anybody with parosmia, or even without actually, it's Parosmia Awareness Day on Thursday. It was established in, I think this is the 3rd year now, by Linda Frantisak, one of our 5th Sense ambassadors in the USA. And it takes place on the 27th of June every year. So that's 4 months after Anosmia Awareness Day, because that's around about the time that it can take people who are recovering from anosmia to start to get possibly some problems with distorted smell. Okay, there'll be a big push on social media on the day. So if you are on social media, if you wouldn't mind liking and sharing and making a noise about parosmia, just as we did with Anosmia Awareness Day, that would be really, really good. So anyone based in the UK may be interested to know that we're at the RHS Hampton Court Palace Garden Festival with our Making Sense Garden. It's an outdoor space with people affected by smell and taste disorders at the heart of its design. And it'll be open to members of the public from next Tuesday, the 2nd of July, until Sunday, the 7th of July. Okay, and please do consider joining 5th Sense for free. It's a great way to find out about what we're doing to support you, and also about the online groups that we offer, so you can get priority booking for those kind of things. And if you want to get involved as a member of 5th Sense, if you're living with it yourself, or you're supporting a family or friend, or you're a medical professional and have an interest in smell and taste disorders, please do join. Anyone interested in volunteering as a patient or a professional can contact Sally, our Community Development Officer. Don't know if you want to flag yourself, Sally, there, just to let people know. She's been making sure everything runs smoothly and should be delighted to hear from you. And Sally, did you want to say anything more about what Jenny's doing in terms of the Manchester group for parosmia?
Yep, sure. So we have our wonderful volunteer Jenny that you heard from earlier, and she's looking to set up a parosmia meetup in the Manchester area for the late summer. So we're looking at September time. So if anybody is in the Manchester area and would like to get involved with that, then do email me. I've put my email address in the chat, so do get in contact. And if you're in another part of the country and you'd like to get involved, then again, do just contact me and we can have a chat and see what we can do together. Thank you.
Thanks, Sally. Okay, so that's the end of the session. What we'd like you to do, if you were going to fill the survey in, is if you could click the link now. Once you've clicked the link, you'll be able to fill that survey in. What we'll do is pop everybody into the waiting room again, just so you can complete your survey without being interrupted. And then what you can do is you can just leave when you've completed your survey. And the waiting room will automatically close when we end the session. So if you have any difficulty, just know that you don't have to worry about it. We will be ending the session and you're not stuck there forever. As I said, if you've got any further questions, I will be picking up emails tomorrow and hopefully able to give you a response if you want any further help or support. And I'd just like to end the session by thanking Hannah and Oki for their contributions, and of course to Jenny as well, who sent hers in. So thank you all very much, and bye.
Thank you.
Goodbye.